few hours from now, the Senate will vote on a Republican bill to defund Planned Parenthood. Let's understand what that vote means. Defunding Planned Parenthood would limit America's women access to critical health services like contraception, breast and cancer screenings, and women visits. This legislation is just another Republican attack on the health care of millions of women, like Sarah from Kentucky. Over the past months, Republicans have worked to trick American women into believing that Republicans don't really want to limit women's access to contraceptives or other critical health services provided by Planned Parenthood. But votes like the one we're going to take in a couple hours lay bare the truth. The cold, hard fact is that a vote to defund Planned Parenthood is a vote to limit access of women to cancer screenings, contraceptives, and other important services Planned Parenthood provides. Our nation is already facing a shortage of primary care providers. For many women, Planned Parenthood is their preferred medical provider. 1 in 5 American women will go to Planned Parenthood for services at some time during their lives. Defunding Planned Parenthood and reducing the number of providers available for women to receive contraceptives, other critical health services would reduce women's success to good health and, more importantly, their access to care, which is very direct and to the point. To put it another way, the demand for care would still exist, but there would be fewer providers to render this care. And for many women, Planned Parenthood may be the only provider where they can seek medical help. Republicans are trying to eliminate their access to health centers. Last Thursday, I listened to the senior senator from Texas, where he claimed that this bill that we're going to vote on soon would actually increase access to care for women. I'm surprised. This distinguished member of the Senate, longtime member of the Texas Supreme Court, would say something like that. He and other Republicans believe, I guess, that clinics like community health centers will pick up the slack should Planned Parenthood be defunded. That is simply not true. The director of women's health policy at the Kaiser Family Foundation says, and I quote, "Across the nation, community health centers are already at capacity," close quote. So if you take away Planned Parenthood health centers, women will have no ability to access care, and most will go without the care they need. A Republican senior senator from Maine agrees. Here's what she said, and I quote, "The problem is, in my state and many others, Planned Parenthood is the primary provider of health services in certain parts of our state for women. So I don't know how you would ensure that all the patients in Planned Parenthood would be absorbed by alternative care providers," close quote. In Nevada, Planned Parenthood centers there have served about 22,000 patients a year. Where do these patients go if the Republicans' legislation works? I don't know. They won't get the care they need, that's for sure. Senate Republicans are not being fair to American women. They're trying to shift the responsibility to someone who doesn't exist. It's our responsibility in the Senate to assure that American women have access to care. It's our obligation to protect our wives, our sisters, our daughters, our granddaughters, and protect them from the absurd policies of a Republican Party that has lost its moral compass. Today, Senate Republicans will do just that. The Planned Parenthood bill isn't going anywhere in the Senate. Senate Democrats will fight vigorously this and any other attempt from Republicans to deprive American women of health care.